With liver abscess. Definition: Amebic is a widespread parasitic disease caused by the protozoan Entomoeba histolytica. Amebiasis most commonly result in symptomatic colonization of the gastrointestinal tract, but some patients may develop intestinal invasive disease with ulcerative and inflammatory lesions, called amoebic liver abscess, is the most common extraintestinal manifestation of the Entomoeba histolytica infection. Amoebic liver abscess is marked by a significant male preponderance and is a disease seen most commonly in patients who reside in or have emigrated from an endemic area or have a recent travel history to an endemic area.
Hello friends, today we are going to start discussion of about amoebic liver disease, amoebic liver abscess and will having its correlation with surgery. And please subscribe to my channel if you haven't subscribed yet. So friends, this disease is mainly caused by parasite Entamoeba histolytica, and it is going to be occur mostly in the developing country due to poor sanitation barrier and due to increased contamination of food and water with fecal matter. And here most common route of infection is through feco-oral route. And in this case infective stage for human is quadrinucleate cyst. And friends, this disease is going to be common in young patients. So friends, in GI tract we are going to having presence of quadrinucleate cyst, so they are going to convert into octanucleate cyst, and at last these octanucleate cysts are going to release 8 trophozoites. And friends, in this diagram we can see in ascending colon and in cecum we are going to have presence of octanucleate cyst, and these octanucleate cysts will go and cause the flask-shaped ulcer. These flask-shaped ulcer in ascending colon and in cecum. So friends, these are the most common site of amoebic colitis. So due to presence of these flask-shaped ulcers, these trophozoites are going to penetrate the capillaries, and after penetrating capillaries, these trophozoites are going to enter inside superior mesenteric vein, and from this superior mesenteric vein they will enter inside portal vein, and then they will reaches to liver. After that they are going to cause histolysis. This histolysis of these hepatocytes and necrosis of WBCs. And due to this histolysis of hepatocytes and necrosis of WBC, it leads to collection of reddish brown fluid and called as anchovy sauce appearance. And friends, in these patients we are having some clinical features or clinical manifestation like abdominal pain, fever, increase in temperature of patient, fever, anorexia, fatigue, and jaundice rarely.
Causes: These parasites causes amebiasis in intestinal infection, also called amoebic dysentery. After an infection, if occurred, the parasite can be transported through the blood from the intestines to the liver. Amebiasis is spread by the consumption of water or food contaminated with fecal matter. In some occasions, this is due to the use of human excrete as fertilizers. Amebiasis is also spread by direct contact between people. Risk factors. The risk factors that the previous to amoebic liver abscess are some recent treaty a tropical region, alcoholism, cancer, malnutrition. Symptoms: general there are no symptoms of intestinal infection, but people with an amoebic liver abscess do have symptoms: more sensitive abdominal pain in the upper right region of the abdomen, fever and chills, diarrhea, discomfort, jaundice, yellow discolorations of the skin, mucous membranes or eyes. Treatments: mitomycin remains the drug of choice for treatment, followed by a luminal agent to eradicate the asymptomatic cure state. The drug most used to treat abscess amoebic liver is metronidazole file 100 to 750 mg orally or intravenously 3 times a day for 7 attempts. That is in same dose and duration used for the intestinal amebiasis. Conclusion. In conclusion, amoebic liver abscess occurs in middle-aged patients without gender preference, just main symptoms in fever and pain. In right hypochondrial use, importance is to develop protocols for management of the disease with the aim of improving the quality of life of the patient. In contrast, prior treatment with metronidazole significantly reduced the ability to diet gallina lectin insert from patients with amoebic liver abscess.